we as doctors, we all take our oath that we're trying to do no harm.
Correct.
And I think that many times we are trying to do what we think is right. And when you have a situation where somebody's telling you, I don't feel like I'm in my right body, I don't want to be a girl or I don't want to be a boy, and you're thinking, if I do this, I'm going to help them, I'm going to help give them some more time until they can figure it out. Or, you know, they don't like their breasts and they're ripping them off or they're doing different things. And so I don't think that any of these, the people who are doing what they're doing it are doing it in a way to harm them. But sometimes when you try to help, you might actually be harming. And so I think that trying to, unfortunately, evidence-based medicine is how you figure it out. Unfortunately, we live in a litigious society. So when all these studies come out, and when they realize that it's possible that these doctors caused harm, I think a lot of them can become fearful that even though they had all the consents in the world, that these people will go back and sue and say, you know, you did this surgery to me, and now I'm scarred for life and I have all these problems. So I do think that many physicians, and this is also with the political climate, that many people foresaw this. They foresaw giving these kids all these puberty blockers and things could possibly be harmful, and we did not have enough research and evidence-based before you start doing all these things that it could be harmful. And that's the importance of dispelling fake stuff, getting the fake stuff out, that you, oh yeah, if you do this immediately, this is gonna decrease suicide rates. We don't know. Have we done the research that doing all these things is gonna help these kids?
Nick, can you tell us about the phalloplasty? That's where a female wants a fake penis, I guess? Like,
Yeah,
what does that
so-
procedure entail?
So those gender affirmation surgeries, they call them bottom surgeries. And so female to male is more complicated. And typically it involves like a team of different specialists. So you may need a gynecologist,
Urologist.
a urologist, and a plastic surgeon who specializes in like microvascular surgery. So the phalloplasty, first for female to male, they need a construct for the shaft. So the shaft usually is the radial forearm. So they take some tissue from your forearm, along with the blood vessels and the nerves, because you want sensation. And anastomosis are connected to some blood vessels in your pelvic area. Sometimes these patients, they have a hysterectomy prior to this. Sometimes they have their ovaries removed. I don't think you have to have your ovaries removed, but that's part of the procedure. You have to recreate you have to make the scrotum, and then they use a prosthesis for the testicles. And then at the same time, the urethra, you have to lengthen the female urethra to fit into this construct. So it's usually staged. They do one part of the procedure, and then they may come back like 4 to 6 months after. And not only the surgery is very complicated, they can also end up with complications. So
Is it a high rate of complication? Because, again, we always...
there are some complications that, sometimes, you can have a urethral stricture, you lose some skin. So they usually stage it.
So urethral stricture is basically where they pee, it gets closed off so they don't
Right.
have problems peeing.
Right.
Okay.
So they put in a stent. Usually they have a stent in, and the stent is taken out after a period of time. Now, mind you, I don't perform the surgery, but when you're having the surgery, most of these centers, they want you to stay there for like a month.
Ooh.
Yeah, just so they.
Oh my goodness.
Yeah, because they want to make sure everything goes well, and if you have a complication, they need to be able to get to you quickly. And so prior to these surgeries, they actually have to have a pretty lengthy, detailed psych workup where they get approval or clearance by two psychiatrists as it's a pretty
Sounds
lengthy
like
workup.
this is not a kind of journey that you want a kid to be going
No, absolutely.
Right.
I don't
So-
think
I don't
I've
think
never
do them
heard
for
of
children.
anyone doing bottom surgery on a child.
Well,
I do think they do the breasts.
They do puberty blockers and try to prevent
Yeah.
breasts from forming, but still, even the medications themselves, they're not without risk. They are without harm. But the bottom line is the justification that's used is, again, a prevention of
Flawed.
suicide, right? But I would say Denmark is a country that, they were early to accept transgender medicine, transgender issues, and conform as a society. And what they're finding now, looking back, is that, well, you know what? There is a high risk of regret, but not only that, there's also a higher rate of suicide among transgender individuals, the ones that
After the
complete.
transition.
Right.
The ones that we were trying to decrease, and that's what it's all about. Once you, unfortunately, as in science, in medicine, this is what we do. We try something, we come up with an intervention, and sometimes it works well, and sometimes we realize that our intervention actually caused more problems, and then we have
Right.
to sometimes pull back that intervention. And so it can't be antidotal. And sometimes we love to say, I told you so, I told you that wasn't gonna work. We knew that was crazy all along. But if you have some people are saying, this is helping me, I love this surgery, it's changed my life, and you have a few people, and I said it wasn't, the only way you're gonna be able to sort it out is to show the numbers. And I think Denmark, like you said, has shown the numbers, and maybe the more information we have, and hopefully they can stop suppressing the numbers, and we can get the true facts and get what's real, and we can stop being anecdotal and say, this is actually saving lives, and this is not saving lives.
There we go.
Perfect.
All right.